have an amendment that actually lights a light, and it's called reference-based reference-based healthcare, okay? So what does that mean? Well, I belong to a committee of about, 10 to 15 retired and active doctors, retired and active insurance agents, and over these last 10 years, we came up with this reform. It's an option. It doesn't replace anything. It's simply an option in state statute that insurance companies can offer. And what it does, and you heard Senator Marty complain about the bureaucracy, and I've harped on the bureaucracy. So Senator Marty and I both agree that a lot of waste, fraud, and abuse and high cost of our healthcare system is the bureaucracy. And not only does it create high cost and waste, fraud, and abuse, it also micromanages, in many cases, the doctor-patient relationship. We need to free the doctor up, and we need to allow patients to go to the doctor that they desire and want rather than their network. Now, in the last 10 years, one of the things I learned from some of the doctors is that our health insurance companies in this state, or HMOs, they can basically come to a doctor within a day or two, and for whatever reason, they don't even need to give one, they can push that doctor out of the network. Well, those doctors, 50 to 60% of their patients are in network, in some cases more. So they have the risk, if they don't cooperate with these overlords from the HMOs, to lose a huge percentage of their income and patients basically overnight. Currently, according to the information was shared, they don't even have to give them a reason why they kick them out of the network. They can just do it. Members, that's ridiculous. So we basically have these doctors who are locked into listening to bureaucrats and micromanaging them in terms of what, if, and how much health care they can give. And the networks are shrinking, which means there's less choice coming across for our healthcare system, along with pre-certification and everything else. What reference-based healthcare does, it eliminates 90% of the bureaucracy. There's no networks. It's for the individual and small group market, and the patient selects a plan to pay so much over Medicare, either 50%, 100%, 170%, or up to 200%. So when they go to the doctor, they can have a plan. They can go to the doctor of their choice, and their plan they can tell the doctor, my plan reimburses 100% over Medicare. And it's subject to the Obamacare rules and open enrollment and everything else. So it still is guaranteed issue. There's no underwriting. But it eliminates over 30% of the bureaucracy, which will drop premiums and deductibles dramatically. The other thing to understand, because it reimburses at a much higher rate than Medicare or Medicaid, it'll help stabilize the hospitals and doctors with higher reimbursement versus going with a government-run bureaucracy and single-payer plan. So members, this is an option. That's all it is. But it frees up patients, and it's only those who want to take advantage of it. So it frees up a patient to go to the doctor of their choice. The doctor is no longer micromanaged by a bureaucracy on what they can and can't do. They don't have to worry about losing their patients. And members, it's a big step in the right direction as far as cost. The other thing is, I'll give one last example. Let's say I have a plan that reimburses 100% over Medicare. So I go to a doctor and he says, I ask him, will you accept 100% over Medicare as far as reimbursement? And he says, no, I want 150%. Well, at that point, you either have to pay the difference or you have to go to a different doctor. but you get to control where and who you go to, not a bureaucracy of networks. So members, and each year during open enrollment, you can select a higher reimbursement or a lower reimbursement plan depending on your relationship with the doctor. The patient replaces the multi-billion-dollar bureaucracy, both in our health insurance companies and in government. So please, members, support this option and vote green. And thank you for your consideration.
Senator Wick.